We here at St. John and at Peace Health have always been dedicated to safety, quality, and innovation. We like to think of ourselves as trying to get on the front end of things. The operating room is a very, very busy environment. And one of the key tasks that nurses have, the circulating nurses, is to make sure that the amount of sponges that go in also come out. As a surgeon, I'm not focused on the secondary technical issues of sponges and instruments. I'm really focused on that patient. You're not thinking about one or two sponges. And in fact, you count on your staff at the end of a procedure to give you those cues. Doctor's sponge count is correct. They count in batches of 5 and 10. Counting is really easy. And they do a 99.98% job well done. Unfortunately, that 0.02, when you think of all the procedures through all the operating rooms in this country, is about 4,000 to 6,000 retained sponges a year. So as a statistic, 0.02 doesn't sound like that much, but that 0.02 might be one of 6,000 and you might be one of those 6,000. That's why it's a big deal. It happens. What SurgiCount has shown through the years that they've been doing this is they've been able to take those rare occurrences and make them zero. We have 9 hospitals across 3 states. There were 2 people that were tasked to implement SurgiCount in all those hospitals. It's myself and my partner, Lana Terry. She and I were able to do this only because of the phenomenal support that SurgiCount had. They had their vice president who was with us at every step in education. They had a large team of nurses, seasoned OR veterans who did all the education to the staff. They had the street credibility to go to them and say, I've worked in ORs for 30 plus years. I've been teaching SurgiCount for X amount of years. And they were just phenomenal in getting that. We've not had a misstep. If you just start at the philosophy level of whether you should implement technology or not, I think there's every case to be made. These events happen. They happen everywhere. They happen in every hospital system. We are human, and we can no longer count on the human mind, even as groups of humans, to remember to do the right thing every time. We need help. And this is a very, in my opinion, a very cost-effective way of providing that help. It's a win-win. It really is a win-win.